All right, everybody, I am Kirby White. We're going to do a little bit of learning together because I've been doing a bunch of reading the last couple days about coronavirus tests and some of the statistics about them. And I don't know anything about medicine or physiology or anything, but I do know a thing or two about statistics and data analytics. And so I thought I'd share some of the information that I got from reading about these tests with you because after I learned about it, I really felt like I was just surprised that I hadn't heard this stuff before. So there's kind of three main points that I want to get across in this video. First of all, I want to talk about how a test that's supposedly 95% accurate can be completely useless and not give us any information that's actually valuable. I also want to talk about some of the ways that you might actually have the coronavirus yet get a negative test. And what some of the implications are of that. And I also want to talk about the timeline of testing. So how long has it been since you were exposed or possibly infected and how that might affect the coronavirus test results that you get. So I'm hoping this will be 10, 12 minutes, but we'll see what happens. Okay, so let's imagine that, that 100 people go in to get a test and 95 of them get an accurate test result. So if they have the coronavirus, they get a positive test. 95 divided by 100 gives us 95%. We would say that this is a 95% accurate test, and that is legitimate. That is the metric we should be using, and that's the correct math for it. However, that is not the metric that we care the most about in this particular situation. It's not a very useful metric for us, and so that's what I want to explain first. We said 100 people went to get their test, and let's imagine it's these 100 people. 95 of them do not have the coronavirus, and 5 do. And in this example, 100 out of these, all 100 of these people got a negative test result. They received a result that says you do not have the coronavirus test. So there were only 5 people that got the wrong test. It was, the 5 people we care about the most. And so when we start plotting the results that we get from the test compared to the reality of the situation, we can put it in something that's sometimes called a confusion matrix or maybe a truth table. And we'll start with the columns. If they, in reality, actually have the coronavirus and they're infected with it, we want to log that person in the left column. Now, we don't actually know this for sure, so that's what the test is trying to help us figure out. But let's imagine we did know reality perfectly well. We can log them in these columns. If they don't have the coronavirus, they're going in the right-hand side. Now, when we add the test result, that gives us this 2x2 matrix here, because if they also get a positive result, they're going to be in that top row. And so for those people that are both actually infected with it and get a positive test result, we're going to call that a true positive. Likewise, if they don't have the coronavirus and they get a negative test result, that's a true negative. So those are the ones that we really, really want to maximize. Any other combination is some sort of false result, either a false positive or a false negative. And so in this example, let's see how it shakes out. We see that we have 95 people that get a true negative result, and there's 5 people in the left-hand column that actually have the coronavirus, but they still got a negative test result. And those are the ones that we care the most about. And so there's 2 metrics that we should really, really be thinking about with this. They are called accuracy and the false negative rate. And accuracy is thrown around a whole lot, and it doesn't actually mean what you probably are interpreting it as. And so I'm sorry, there's a little bit of math and formulas for this, but accuracy is simply the number of correct results divided by the total number of predictions that you made. The false negative rate is the number of false negatives from the test divided by the number of results that should have been positive. And so again, with our example, here's how the math works out for that. We have a 95% accurate test here with a 100% false negative rate, meaning that this didn't help us at all because it was unable to identify the people that are actually sick. Now let me zoom out for just a second and say that none of this so far that I'm talking about is new for the coronavirus. False positives and false negatives are damaging across a whole bunch of medical situations. Specifically for the coronavirus, a false positive might mean that somebody gets admitted to a hospital, they start receiving treatment, they're getting physician attention when they don't actually need it. They're not sick with the coronavirus. So maybe the test was just wrong or they have something else. But whatever it is, we want to avoid false positives. Thankfully, with the coronavirus test, it's actually a really small false positive rate. It's something like 2% of the positive results that come out from the test should have been negative. So there's really not much error in the positive results. False negative, though, this is really the one that we should care about, especially for an infectious disease, because if somebody has the coronavirus and they get a false negative test, they're going to think they're fine. They may relax their social distancing standards. They may go visit their grandparents who are immunocompromised or in a nursing home. They may just visit their family and give it to them, and then they can go give it to somebody else. So a false negative is really damaging for our ability to curtail and limit the spread of the coronavirus. And so that's why the false negative rate is really the metric that we should be thinking about. You might actually be surprised at how many ways there are to come up with different metrics just on these 4 numbers that I've pointed out to you. So I'm not talking about specificity or sensitivity or recall or the F1 score or likelihood or the relative risk ratios or odds ratios or anything like that. There's a whole bunch of stuff that researchers will look at as they're building statistics and understanding of their tests that doesn't matter to you. For most people, these 2 metrics are probably the ones that you should be aware of and understand how to work with them. So I learned about this and I thought it was interesting, but really it hit the the rubber met the road for me when I began to read about how the false negative rate changes over time with the coronavirus. So far I've just talked about a hypothetical, theoretical example, but now let's go look at the actual false negative rates from peer-reviewed studies of the coronavirus tests. So here on the screen is a simple line plot of, on your x-axis you've got days since infection or exposure, and on the y-axis you've got your false negative rate. And so what this is telling us is that on days 0 and 1 after getting infected, there's a 100% false negative rate. So that means if you get exposed to it and if you get infected and you immediately go to the doctor and get a coronavirus test, it's going to come back negative, and it will be an inaccurate negative. It should have been positive, but there wasn't enough of the virus in your system for it to detect it. So you'll get a negative result within 24 hours of being infected. Now, if we head over to this next point, this is day 4. On day 4, it's a 67% false negative rate. So that means if 10 people if 10 people actually have the coronavirus, 6.5 or 7 of them are going to get a negative result when it should have been positive. That's really high. On day 5, it actually has gone down quite a bit, so it's improved, but it's still at 40% right here, 38% specifically. I'll actually throw up the specific numbers right here. And day 5 is really the time that we need to care about, because it usually takes 5 days from exposure and infection to feeling symptoms. So for those first 4 days, most people will feel perfectly fine. It's on that 5th day when somebody will start to feel like they have a fever, maybe they get some chills or a sore throat. They go to the doctor, they get the test. At that time, it's still a 40% false negative rate. If 5 people have the coronavirus and they feel sick and they go to the doctor, 2 of those 5 are going to get a negative test result. And that is really high. And so you'll see the numbers, they drop down at days 8 and 9. That's about the lowest it gets at 20 and 21%. It actually starts to go up after that, presumably because the person is fighting the infection. There's less of the virus in their system, so it's harder to detect as they're recovering. And so on day 21, it's about 66% right there. And I should be clear, these are just the numbers for it's called I forget if it's real-time polymerase chain reaction or reverse transcriptase polymerase chain reaction, but it's a particular type of molecular diagnostic test, and it's the one that everybody's talking about, where they take a Q-tip that's about 60 feet long and they snake it through your labyrinth of a brain to tickle the back of your throat, and they get a little bit of sputum to bring back, and then they'll test that in the lab. So this is not the 1-hour diagnostic test. This is not the antibody test. It's a diagnostic test. And so we took all this in, and now let's think about some of the implications. What do we do with this? So the first one is that physical distancing is still the best protection, because even if you have a negative test result, you might be spreading it to somebody else. And so if you go to the doctor, if you get a negative test result, you should still be taking the precautions that everybody's telling you to do, like wear a mask, only go outside when it's essential, stay 6 feet apart from each other, things like that. The second one is that after a high-risk activity or a possible exposure, maybe you went to a wedding and there was just a lot of, really fun dancing in a crowded space, that's a high-risk activity and you may have been exposed. If you go get a test the day after that wedding or flying or something like that, it's going to be negative, and it may be falsely negative. And so it's something where you should be practicing that isolation even if you get a negative test result soon after some exposures. So it is not wise to fly from one place to another, get off the plane, get a test, think that you're good because you may have picked it up on the plane ride there, and then go visit a bunch of people. It's just not a good idea. If you feel sick, go get a test. If you're feeling sick, it's probably been 5 days since you were exposed. You can go to the doctor. They will make a clinical diagnosis, which is different than the laboratory diagnosis, where they'll say you have all these symptoms. You may have, if there's a good chance that you were exposed to it and you may have gotten infected, they may be willing to override a negative test result and say, look, I think you have the coronavirus, even though the test came back negative. Perhaps they'll do a second test just to verify. And so that brings me to the fourth implication. If you had a likely exposure, or you really think that you may, if there's a good chance that you've had it, you might want to ask about getting 2 tests and talk to your doctor about that, because 2 tests being false negatives is far less likely than a single test being a false negative. In some of the reading that I was doing, in the most extreme situations imaginable, which are probably not even realistic, but they were saying that potentially somebody should take 4 coronavirus tests and have them all come back as negative before you start to believe it. Now, for most of the people I think that I've talked to or understand what their behaviors are like, my understanding of the reading that I did and their behaviors is that a maximum of 2 tests is probably going to be good enough for your situation. So anyway, that's just some of the reading that I've done the last couple days. Let me know if you have any questions or curiosities or other information that's important and insightful. I will go ahead and share links to the readings. You're welcome to take a look at those. But for now, goodbye.